Moments ago, the president signed an executive order that will reduce the price of prescription drugs. Watch this.
Starting today, the United States will no longer subsidize the health care of foreign countries, which is what we were doing. What's been happening is we've been subsidizing other countries throughout the world, not just in Europe, throughout the world. So for the first time in many years, we'll slash the cost of prescription drugs, and we will bring fairness to America. We're getting them down 60, 70, 80, 90%, but actually more than that if you think about it in the way mathematically.
Extraordinary stuff. Health and Human Services Secretary Robert F. Kennedy Jr. was in the room when Trump signed the order, and he joins me now. Mr. Secretary, Trump says some prices will come down almost immediately. What is the timetable for these price cuts?
Well, there's a series of escalating steps, but you know what, that will bring them down to European levels. Right now, America provides 75% of the pharmaceutical revenues in the world, and we only have 4.2% of the world's population.
Sure.
We're paying, in our country, the list price for Ozempic is $1,300 per dose. In London, it's $88. And Democratic and Republican politicians have been talking about for years, we got to end these discrepancies. Nobody has had the courage to do it because of the power of the pharmaceutical lobby on Capitol Hill.
Okay.
In answer to your question, how soon will this happen? It depends on how enthusiastically the drug companies cooperate. There are a series of escalating steps that we will take if they don't cooperate. But we're we've been meeting with the pharmaceutical companies. They admit that this is something that should have ended a long time ago. And I think they're ready to figure out a way to get there. And they have advantages in this executive order, Stuart.
Okay.
Because we get rid of the PBMs, we get rid of the middlemen, and that's something that they've wanted themselves.
Dr. Mark Siegel was on the program just a few minutes ago, and he said the devil is in the details. Specifically, do these drug price cuts apply to Medicare Part D? Can you answer the question?
Yeah, they absolutely will. Oh. They'll apply to Medicare, and they'll apply in the private market as well.
There are some critics of this who say, look, these are price controls, almost neo-socialist price controls on drug prices. What's your answer to that?
My answer is it's getting rid of price controls, because the European governments have told the drug companies, here is the maximum price we're going to pay. We're not going to pay any more. If you don't give us this price, you can't sell it in our country. That is the epitome of a price control. President Trump is returning the marketplace to this and saying, look, we're going to have a global marketplace. We're going to pay the same thing in one country as we're going to pay it in the other. And we're going to stop subsidizing healthcare costs in Europe. So we are subsidizing socialized medicine in Europe on the backs of U.S. patients who are going bankrupt to pay these prices. The number one cause of bankruptcy in this country now is healthcare costs.
Yep.
And we have all these Americans who, we're getting them better, but then they are bankrupt and they have no money in order to subsidize price controls in Europe. So President Trump is going to get rid of the price controls.
You said that some of your children, some of whom are Bernie Sanders supporters, were moved to tears by this announcement. It occurs to me that basically you've stolen the Democrat issue. You've just taken it away from them and you've done it yourself.
Yeah, I mean, when the Democratic Party, I grew up with the central issues. We were against NAFTA, and President Trump has now stolen that from them.
Yeah.
We were against. We were skeptical toward big ag and big pharma, and President Trump has stolen that from them. And the major fulcrum of Bernie Sanders' campaign has been, we are going to equalize drug prices in Europe and the United States. He was never able to do it because of the power of the pharmaceutical lobby. No Republican or Democrat has been able to do it, but we have a president, and I pointed this out, President Trump took $100 million from pharma. He can't be bought, and he is doing something. He is standing up for the American people here, Stuart, and I think, even my kids who are who are pretty left wing see that, and they were very moved by it.
Mr. Secretary, it looks like you're having a lot of fun in your job these days. And it was a pleasure to have you on the program today. Come back soon, please. RFK Jr. Thank you, sir.
Thank you, Stuart.
You got it.